Here we are. We're here to talk about Apex today. So, literally the most remarkable, comprehensive treatment for erectile dysfunction that has ever existed. So, this is me. So, I'm specialty trained in both obstetrics, gynecology, and general surgery. Completed my residency in emergency medicine. I'm a board certified ER physician, and I am the owner and CEO of a clinic here in Newport, Rhode Island called FirmMD. So, how did I get here today to speak to you all about erectile dysfunction? We're a small practice. We have 2 treatment rooms, 2 providers. This is Paige, my nurse injector, myself, Lindsay, my office manager. So, we've only been in business for a little over 18 months, and yet I'm here speaking to you all today. And so I want to kind of just give you a blueprint for what, we did to be able to get here and achieve success. And really, it all ties into my connection with InMode. InMode really helped us significantly. So I talked to my practice manager. I said, look, I'd like to just create a chart where we looked at our gross revenue based on month and kind of track it out, because I thought it was interesting to look at. So, we started in January of 2024. We had both an aesthetics arm and then also a longevity medicine practice, ultimately with the plans to build up a full-scale functional medicine practice. So we started out with a Neogen plasma device for facial regeneration. We had a competitor's RF microneedling device, which was the best on the market at the time. Had a built-in ultrasound, so ER physicians, we really like our ultrasound. So, but with that, also had a shockwave device to treat erectile dysfunction, and then also a facial device. And then outside of that, we were getting into weight loss was big right from the beginning, as I'm sure a lot of you guys have experienced. HRT, hair loss, and then dabbling sort of in the sexual wellness with some of the shockwave therapy and P shots. And you can see things were going okay. We started off when we sort of hit this plateau where we're kind of in this $75,000 a month gross revenue range, which is certainly not bad. I'm sure some of you might say, wow, that's pretty good. But I bought a lot of devices. We had a lot of expenses, and so we had a lot. There was money coming in, but there was a lot of money going out too. And so it was around that time that sort of around, I guess, August of 2024, that my practice manager is great because she's really good about shielding me from all these device reps that come in. I'm sure you guys know that, you're bombarded by all these reps that come in when you open a practice. It's like, I don't even know how you guys heard of us. I didn't know how you would have even know that we opened, but they come in and they continue to bombard you. And one day Lindsay says, okay, Zach is here from InMode. And I go, okay. And she's like, well, it's InMode, the Morpheus. And I said, all right, fine. So I'm sitting there and he's pitching me on the Empower because he knew I had a background in OBGYN. We were already addressing some of the men's sexual wellness stuff, and he's selling me on Empower, which sounded great. And he was also wanted to add on a couple of handpieces with the Morpheus face and the Morpheus body. And as he's, I remember very vividly, as he's sitting there across from my desk talking to me, I'm looking at this competing device, which I had spent $150,000 on. It was literally collecting dust in my office. Like I had my coat draped over it. It was like the elliptical machine that people have in their basement. And he's like, well, you really should consider adding on a Morpheus. And I'm like, I don't know. I don't know if I don't need it. But at the same time, I was staring at this device. I said, look, I've sold 0 packages in 6 months. 0. And for whatever reason, I just had some sort of leap of faith. I trusted him. I believed in him and we ended up buying the Empower platform with the Morpheus face and body, as well as a laser hair removal device, which is great. And we saw this pop. And initially what it was Morpheus. I was able to sell this competing RF microneedling device. I took a $110,000 loss on it, and I still counted that as a win, because what ended up happening was the first few months is all of a sudden we saw this surge in volume. We saw these people seeking us out, looking for Morpheus treatments. They were Googling us or looked at our social, saw that we had Morpheus, and all of a sudden the device, it sort of kind of started selling itself. Now, from that point, with the women's sexual wellness platform, the Empower, it was much more of what I would describe as like a smoldering growth, where we had an event. Our InMode reps, Zach and Jess, helped us put it on. It was nice. We had champagne, caviar, had a couple of speakers, and we had about 30 women there. And initially, it felt like it might have been a bit of a failure because we didn't see all these women signing up. But I can tell you, in the last year, almost every single one of them have gone on to sign up. They're happy with their results. They're telling their friends. And then it's really is sort of this like groundswell of word of mouth advertising. Because we found when we posted on socials, we could post something about HRT, you could post something about Botox. If you post something about like sexual wellness, we would track it. And to the day, you could see we had more unfollows than follows, which is really kind of sad, But that's just the nature of some of this business. But really what it is word of mouth. You provide a good service, a great treatment, a revolutionary treatment that for me, even as a former OBGYN, we were never able to provide the surgical outcomes that you can do with 3 15-minute procedures in the office. It's amazing. So fast forward a couple months, we're doing really well. And then again, Zach comes in my office and says, hey, we want you to be the face of this new device. And so I'm in business for less than a year. I'm very flattered. That sounds great. I asked him what it was. And when he told me it was an erectile dysfunction device, I said, why? Why me? That's interesting. Okay. Not what I was predicting, but okay, sure. And then also the Solar, their fractionated CO2 laser, which, all of our clients were begging for a CO2 laser. So, and again, we saw another pop in growth. But so the question is, how do we incorporate that into our existing practice? How many people out there have Empower as part of their, well, okay. How many people have Apex? Great, okay. So you notice that, there's certainly a big crossover potential, but it can be challenging to market it, right? So how do you do it, right? So we came out, we all desperate this little gas station mystery villas in Vegas. Come on, guys, we can do better than this. And we're proud to be one of the nation's first providers to have the Apex, groundbreaking new device that treats erectile dysfunction without needles, without pills, without awkward gas station counters. I don't stop settling and start fixing the root cause of the problem. It's confidence. Let's go to the package. All right, so that's one way you could do it, right? So we a little social media splurge and try to make it fun and approachable. But I can guarantee you, by a show of hands, how many women out there knew that there were gas station boner pills that existed? Not many. I'm not even gonna ask the guys because all of the guys know that is a thing. That is in fact a thing. So it's funny because we got like 500 DMs from women being like, is that a thing? No, guys. So anyway, I refer to erectile dysfunction. It really is closely tied in with hormone deficiency, as a lot of us know, but I refer to it as a silent epidemic. There's a study that came out about a year ago that showed the average testosterone level for 18-year-old males today versus 70 years ago. And it is literally 1/3 of the levels that it was 70 years ago. So, you see all these old timers that say, men aren't men anymore. So it's kind of true. There's some truth to that. And as I'm sure a lot of the women in the audience who are dating today can probably attest, they might agree with that sentiment too. So, but it really is a true epidemic that we're seeing due to a variety of reasons. But this slide just talks a little bit about erectile dysfunction. And when you look at the numbers here too, 5% of men 20 to 40, these are all questionnaires. I can guarantee you that these are underreported numbers. These numbers are dramatically lower than the reality. As someone who has a lot of friends in their 20s and 30s, the number of times that as a physician, I've been asked to write a script for a friend of mine for Cialis or Viagra, kind of surreptitiously, without telling anyone else. It's not 5%. The numbers are, in my opinion, dramatically understated. I think they're significantly larger than that. So when we're looking at this kind of market of men that we can pitch this to, it's bigger than the numbers would indicate. So And why, when we look at why it's important, we look at quality of life, relationship health, emotional well-being. I mean, really a lot of men's self-image is tied into their penis. It just is. It's their sense of like vitality and strength and manhood. So, we look at the opportunity that we have here. I mean, this is a huge market that we can capture. We look at all of our patients that have diabetes, other vascular diseases. It's enormous. So, and for me, as a physician who's been treating this now for the past several years, I can tell you that there's very rarely a sole organic cause for ED. There's always some other component. There's always multiple factors kind of tying in here, and almost always some sort of psychogenic component as well, because it's, it can get in someone's head. When they don't perform one time, you have this adrenal surge, which really is just, you want a parasympathetic response to get an erection. So if the more that you're in your head, the more it is kind of just a negative feedback loop. And ultimately, for a lot of these guys, especially the ones that take the step towards getting Apex, they just have some sort of confidence that they're addressing the issue, and they notice that things will dramatically improve from that alone, just kind of feeling like they're doing something, not to mention the fact that it actually works. So when you look at the market itself, the numbers here listed at 18 million in the US. Again, I would argue that those numbers are underreported, and that the market that we're looking at is probably at least twice that. So, when looking again at Apex, it says 52% of men aged 40 to 70 are affected by ED. 70% of them are fed up with just taking a pill. It really is, for men that patients that I've talked to that are taking Viagra or Cialis, they all kind of report some sort of shame. They feel ashamed that they have to slip a pill in their mouth. Maybe they tell their partner. Oftentimes they don't, but they were looking for some sort of solution that's out there that exceeds what we're providing with just pills, with just medication. So, and I can tell you from having done this, I was lucky enough to be one of the first in the country to get the Apex device back in February. We've been treating men now for the last 4 or so months. 100% of these guys are satisfied with their treatment. We have 100% of them are seeing significant clinical improvement. And so for those of us providing aesthetic treatments or other treatments in our office related to regenerative or longevity medicine, pretty rare that we're seeing something with 100% results. I don't know about you guys, but there's really not much else out there that I have done where I have 100% of patients coming in saying, hey, I'm happy with my results. So again, traditional medications, you have poor adherence, long-term side effects, lack of efficacy over time, declining use over time, and again, a growing demand of guys that are looking for something else out there that can provide this solution. So when you look at the market, we're looking at almost a projected 4 billion plus market within the next 10 years. I mean, we think about if you had been one of the first people to provide Botox 20 years ago, or filler 15 years ago, you are poised to be a market leader, an innovator in a space that I think is within the space of regenerative and wellness medicine is really going to pop. I mean, we're seeing that from the women's side, and it is with a lot of things. Women tend to be maybe a little smarter than guys. They're definitely first movers. They're early adopters for a lot of therapies. We're guys, we're a little bit more stubborn. It takes us a little while to kind of come around to admit there's an issue, and 2, to actually take the steps to address it. But there are ways that we can kind of coax them along. So, why are we poised to lead this charge, as a med spa, or however you brand yourself? Well, mostly it comes down to trust. People are coming in, they're trusting us with their aesthetic treatments. They're trusting us to optimize their hormones. They're trusting us to help them achieve their weight loss goals. So we're someone that they believe in, they trust. And so when we offer them a solution to something they didn't think there was a solution for, we really have an opportunity here to not only help clients, but also put some money in our pocket too, which is great. So we look at this sad timeline of events when it comes to looking at the history of treatments for erectile dysfunction. So back in the 60s, the penis pump was invented. And just looking at the text there, you can see it's old. It's an old archaic therapy. It's a decent adjunct for guys that are undergoing therapy with Apex. And for a lot of guys, I do recommend that they use a vacuum assist device at home for a couple minutes as their homework. But it certainly was not a comprehensive solution when we look at this problem. So in the 70s, we had the penile implant was invented. So for anyone who's old enough, you could maybe remember like the Reebok pump. But it's kind of like that. It's essentially that. And there's really not much that it's going to kill the mood, during sexual intimacy, like, inflating this, like you're like making a balloon animal or something like that. It's like not really the sexiest thing. And so finally, 22 years later, the FDA approves the vacuum assist device. 22 years, that's not bad for the FDA. It's pretty good for them. And 98, the savior for men's erectile dysfunction is introduced, Viagra, which is, this be-all. But ultimately what it is just a Band-Aid solution. I don't know about you guys, but for me, I really don't like offering Band-Aid solutions for my patients. It feels like there's more we can do. I really like to identify the root cause of the problem, and if we can offer a solution, I feel like that's what we should be doing. So 2010, shockwave therapy is approved by the FDA. Does anyone have a shockwave device in the audience? Okay. Yeah, so I have one too. It was one of the first devices that I bought in hopes of trying to treat erectile dysfunction. So there's a lot of big names out there in the shockwave space, but the truth is, any of the best, you can look at the best studies out there, it's basically a coin flip if it's going to be effective at treating ED. And so for me, I have a hard time pitching something that I don't have a lot of conviction in. I didn't really sell a lot of packages because I'm offering a package of $3,000 to $4,000 to guys, and they're like, well, is it going to work? Maybe, possibly. You have to be really careful with patient selection. And that it's, at the end of the day, maybe 50%. Some studies show up to 80%. I think that's garbage. But, and then 2011 PRP injections, again, maybe a transient solution or improvement, but definitely not the comprehensive solution that we've been looking for. And so all of a sudden, InMode comes out with Apex. And as I said, this is by far the most comprehensive treatment for erectile dysfunction that has ever existed. It really is a groundbreaking device. And the truth is, it's brilliant in its simplicity, like a lot of great, market inventions. I'm sure a lot of other companies have probably tried to incorporate RF technology into within the men's sexual wellness space, but they just haven't been able to. And despite how simple it is, it's obviously a very sensitive area to treat. It's a simple appearing device, but it's really, it senses temperature at 1,000 times a second. The wand itself it's easy to use. It's quick, painless. Zero downtime. These guys are in and out you could do treatments as quick as 20 minutes. I personally bump it up to 30 just to have a little more time on temperature. And I do oftentimes pitch these guys an upgrade where we'll do the shockwave in conjunction with it. For people that don't already have a shockwave device, I would not advocate for going out and getting one because it's not a comprehensive solution. If you have one that's there in your office collecting dust, as I did, I do use it, but you don't have to. So, and when we look at the crossover for potential for those of us who are not just in the aesthetic space, but also in the regenerative medicine space, all of our people, if you're doing aesthetics, right? People that look better feel better. They feel better about themselves. They have more self-confidence. They're more willing to engage in sexual activity once you kind of get them over the hurdle of not disliking the way they look in the mirror. And the same thing goes with our weight loss clients. People that are losing weight, all of a sudden you see our weight loss clients, and I'm sure as a lot of you have seen, 6 months, a year, 2 years into providing weight loss solutions, you have these people coming in saying, hey, I want to address my face. I had a client that came in and she told me she had not looked in a mirror in 10 years. And she meant it. She's like, I took all the mirrors out of my house. I didn't want to see myself. I was so unhappy with my appearance. So now you have these people that are looking better, they're feeling better, and now they want to resume sexual activity. So again, when we look at HRT, I can tell you 100% of my clients that are doing Apex are also on HRT. So there's a huge crossover potential when we look at these people. And sexual wellness, this is obvious, but we've been doing really well with Empower. Empower really was the device, the platform that kind of fueled a lot of our early success. And one of my clients came in and she said, I heard you were offering this new device. And she's like, well, I sat home. They've been married for 30 years, mind you. And she said, I said to my husband, look, if you don't fix your problem, I'm going to go find a friend. It's pretty harsh. That's harsh. So, but that's the kind of sentiment. I can tell you, I think a lot of us who are providing weight loss solutions, for example, women oftentimes are maybe the early adopters, the ones that come in, all of them would say, oh gosh, I think my husband needs this. He should come in and see you. And I was like excited initially when I first opened because I'm like, oh great, more business. They never came in. Didn't come in. 6 months, didn't come in. Maybe 12 months, they started to trickle in. But I can tell you, for the women who have done Empower, who are now feeling like they're sexually vital, that they want to re-engage in sexual activity, when they have this conversation with their husband, there's a much quicker turnaround time. It's not 6 months, it's not 12 months. These guys are coming in. They're coming in within the first week, first month, calling me, seeing if we can get an appointment tomorrow. Do you have any openings tomorrow? So this matters. People care about this, for obvious reasons. Hair loss, the same thing. People, again, if you're looking better, and we're looking at the typical market, if you're treating anything related to hair loss, guys in their 30s to 50s, like these are prime candidates. And it's not guys in their 40s above. I guarantee you, there are a lot of men in their as young as 20s, 20s, 30s. These are guys that want help. They just don't know there's a solution out there. So, initial studies. My initial hesitation, as I'm sure a lot of people that I've talked to have also brought on Apex. My initial hesitation was it's a new technology. Well, it's RF. It's technically not new, but it's a new device. We don't, as a physician, I want to see the data, right? I want to see the studies. I want to see what works. Show me that it works. And ultimately, they weren't able to do that much beyond. There was 3-month data available to me, but as you can see, the data was good. And just as what I always say, there's not a lot of common sense in Western medicine. It's sorely lacking. But for me, as someone that's used RF technology on the face, on the body, we know it's safe. We know that it works. It was intuitive to me that this would be something that's easily applicable to this space as well. And so you can see 44% of men 3 months out improved erectile dysfunction score, 31% improvement in intercourse satisfaction. You guys can see all the numbers up there. They're good. And these are just 3-month numbers. And what we're seeing, I can tell you now, is having done this for the past 4 or 5 months, these improvement scores are getting better and better over time. Okay? So what we do, I have them come in, we do a consultation. I always advocate for having a broad questionnaire. So if you put on a questionnaire and a guy's filling it out, do you have erectile dysfunction? I guarantee you, over half the guys that have erectile dysfunction will not say, yes, I do. You have to ask a couple of different ways just to kind of trick them into admitting that there's a problem. Do you have lower libido? Less enjoyment out of intercourse, more difficulty getting or maintaining erection. You have to ask it a couple of different ways. And if any of those kind of tick positive, it certainly makes that initial conversation that we're having with our clients a lot easier. So treatments are quick, easy, six sessions, under 30 minutes apiece. And then I always track their progress, so we have a little questionnaire, and what I've noticed is we track it at each of the 6 visits. Every single time we've seen improvement with each subsequent visit, and then tracking it at monthly from there on out. And we've noticed that these numbers have gotten better and better and better and better. Okay? Granted, it's a small sample size, and we don't have a lot of long-term data, but it works. So, and the best part for us too is that this is a recurring revenue model. We're locking people into either biannual or annual maintenance programs. So they're already paying up front and they're coming in. Or if they don't, we're still getting paid if they don't come in. So when you look at the ROI on this device, it's fantastic. You're making $400 to $600 for a 20 to 30 minute appointment. Packages, $3,000 to $3,600. And then when you look at the margins are really pretty much 100%. The only cost, there's no consumables associated with it. It's just the cost of a small amount of ultrasound gel that we're using. So for us, these numbers are a little bit old actually. We're closer to 20 clients that we've treated, and the age range is 30 to up to 80, someone in their 80s. 100% of these men are satisfied with their results and would do it again. And the revenue, at least in our first 2 months, we made over $50,000 gross revenue within the first 2 months of bringing on this device. So when we look at how we can integrate this into our existing practice, how we can monetize this, again, as I said before, you want a comprehensive intake evaluation. So you want to ask the question a couple different ways just to capture these men who are desperately looking for help. They just don't know that there's help available. So upselling potential when you look at our clients that do peptides, that are doing HRT, that are doing weight loss, these are all our Apex clients. These are all guys that are looking for solutions. They're a little bit more open-minded, and these are men that are going to sign up to do this. With cross-selling potential, because we have the Empower device, what we've done is we've offered kind of a joint program where if the couple is willing to come in and kind of reinvigorate their sex life together, we're offering discounts for them to do it together. That's been popular. You can come up with a cute little name for it. It's tough to do actually, but ChatGPT it. They're pretty smart. And then informational events. So as I mentioned before, whereas our women's informational event, we had champagne and caviar. For our men's event, I have a friend who played in the NFL, had a couple Super Bowl rings. He came in, everybody wanted to touch his Super Bowl rings, chat. We had a whiskey tasting. I mean, there are a lot of obviously a different way to market it to men than you would to women, but we're pretty simple creatures. It's not tough to figure out. You can find a way to get us in. So, and market it on sports talk radio. We're going to be doing an ad next month on some of the local sports talk radio shows in the Boston and Rhode Island area. And again, it's a subscription model. So once these men come in, you sign them up for a subscription where they're paying either a monthly or a biannual fee to come in and do their maintenance, because they're going to need to do maintenance. What's that? Yes. These are some of our packages here that we're offering, so we can see that you can also bundle it. It's very easy to bundle with other things like HRT. If you have a shockwave device, which you don't need, you can bundle it with that. All of them have done it. It's an easy upcharge. The market itself, we can see here, 66% of these guys said they would refer a friend. 83% of them have signed up for other services within our practice. So you're going to start getting a whole bunch of text messages that are interesting to get. But I think at the end of the day, we all got into this not just aesthetic, but like regenerative medicine space to not just make people feel better, but to actually help, to really help people. And so we're able to do that with this device. I was just going to talk a little bit about some of the support that InMode has offered when it comes to our client support rep. We've got custom brochures that are kind of tailored to our clientele. They've helped us put on events. It's one of those things where, especially with this device, you have the opportunity to be the first mover in a new and growing space. I think that this is poised to be, if not one of the biggest growth areas within the space of regenerative medicine. And on top of that, so first mover, it would be less effective if you had, the med spa next door is offering this treatment, but I think I'm the only person within an hour-and-a-half radius that has this device. So it's been really nice to be able to carve out a little bit of a niche and provide a service where you don't necessarily have to have a lot of expertise. It's super simple to do, easy, fast, painless. And this truly is, you're able to confidently tell these clients that you're offering them the best, most comprehensive solution for erectile dysfunction that's ever existed. You're using InMode, the proven market leader for RF technology. So you have full confidence there. It really is best-in-class support, ongoing support, marketing. No consumables. 100% of these men that I've treated have had improvement in symptoms. That's pretty much it. So this is a win.